Hi, my name is Casey Hobbs.
And where are you originally from?
Originally, I was born in Phoenix, Arizona, and then I moved to Southern California and grew up in Southern California. But then in 1980, so that's been 41 years ago, I moved to San Francisco, the Bay Area, and I've been working here in the Bay Area for 40 years.
And why you decided to stay in the Bay Area?
You know, I think we live in one of the most beautiful places in all of the world. San Francisco sits on the edge of the United States continent, and we look out into an ocean and can see all the way to Japan. And it is a beautiful city because we have everything here. We have the beautiful ocean, we have beaches, mountains are very close to us. The weather is incredible here in Northern California, mostly cool, which is what I like. It doesn't get very hot, which is lovely for me. And we have a very well-rounded group of people here in the United States, especially in San Francisco. What I love about San Francisco is its multi-ethnicity. So every ethnicity you will see here in San Francisco, every walk of life, from poor indigent to very wealthy, runs the spectrum. This is why I love San Francisco so much, because it allows me the ability to work in a metropolitan city.
You have a very interesting history on walking the sequoias.
Yes.
Can you explain a little bit?
Yes. So the Sequoias has several sister companies. So they have a sister company in Marin County called Tamalpais. And I started working there many years ago and worked there for 5 years, actually doing what David's position is, which is the director of clinical services. So running the clinic as well as the assisted living department, as well as being responsible for the health and welfare of the over 300 independent residents. So I started there. I really like this company. And I've been in nursing for 45 years. And there are two places where I think we do holistic care. So the entire time that I've been doing nursing, I've been told, well, we do holistic care, which means we treat the whole person. There's only two places in this country I think we treat the whole person. The first is hospice, and I've worked several hospice companies. And the second is a CCRC, is the Sequoias, in which we treat the whole person. And by that I mean we know their friends and family, we know their pets, we know their lifestyle, we know what food they prefer, we know what medications they take, we know how independent they want to be, so we can support them completely to provide the best possible care. And to me, most of the care in our country is fragmented, but here at the Sequoias, it's not, because we treat the whole person.
Now, your position is Director of Nursing, DON here.
Correct.
So you're working in skilled nursing the most of the time.
Yes.
What do you face the most problem with COVID-19?
You know, the biggest problem with COVID-19 was fear, both for our staff and for our residents. So when we're dealing in a pandemic, especially a pandemic that continues to change and mutate and cause variants, and because of the way it was rolled out in our country, so haphazardly, and at the time we had a president who was denying the very existence of this pandemic. And so here in the United States, it took us a very long time to get a handle on it. So the biggest thing I think is fear, and letting our residents and our staff know, listen, we're going to do everything we can to keep everybody safe. So here in our facility, we have been able to vaccinate all of our residents, both in skilled nursing, assisted living, independent living, memory care unit, everybody, with all of the staff. So here in our community now, what we really worry about are the variants. So we're still wearing a mask. I just took this off because I want you to see my face. But otherwise, I'd be wearing a mask and a face shield, which is constant, because as we know, we can still test positive for this disease. We won't replicate enough of the virus to get sick ourselves, but we could in fact be positive. So we're still doing all the protocols, but boy, it feels so much better to work in an environment where everybody's been vaccinated and where everybody's knowledge level about the disease is very high. So we do a lot of education around the pandemic, and around allaying people's fears.
So, do you actually think the COVID-19 affecting the residents? I mean, the patients?
Yes, and here's how COVID-19 mostly affects us in skilled nursing facilities. So, in any skilled nursing facility here in the United States, I'd say about 50%, if not higher, your residents suffer from dementia. Okay, dementia is a disease that really progresses very rapidly when they don't have their touchstone people. So when they don't see their daughter regularly, or their son, or their spouse, or their best friend on a regular basis, and they lose that interaction, it greatly speeds up the effects of dementia. So unfortunately, what I've seen here in my skilled nursing facility is that we have lost several lives here, not to COVID, but because the dementia increased so rapidly over the year of being quarantined, that it had a really detrimental effect on us. So COVID wasn't the culprit for us. The culprit was being quarantined and not allowing visitors in. We just recently opened up to visitors and opened up to doing activities and freely moving about our skilled nursing facility, and it's made a tremendous difference for the residents that we have here.
Well, is the COVID-19 affected you?
Me personally, yes. So, I was a nurse during the AIDS crisis in the 80s, and there were a lot of similarities here. During the AIDS crisis, we had many, many nurses who refused to work with people who had HIV, and that's after we knew about HIV. And then after, before we knew about transmission, I couldn't much fault them. But then even after we knew about transmission, I had people who wouldn't work with them. Well, we had the same issue here with COVID. So when the pandemic hit, I had 3 staff members who said, I can't work with them. I'm not going to work with anybody. I'm too afraid. And they went off for several months. And what I said to each of them is, listen, this is here to stay. This pandemic is here to stay. Not to mention, we're now opened up to all kinds of new pandemics, which I think is going to be our history, just given our species and how we have progressed medically and physically and spiritually. So this is the beginning. So what I had to do was educate people. This is how it is. We all have to get used to it. So yes, I had fear factor about getting the disease and dying from the disease. I'm older than most of the people who work here. I'm approaching 65, so that puts me in a higher risk category. I also am a cancer survivor. So, and my partner is 70. So for us, this was scary because we were in the high risk group. And me working on the front lines, I had to remind myself, I came through AIDS beautifully. If you know how to protect yourself, if you use proper PPE, you really don't have to be afraid about this pandemic or any others. And, I have been able to keep myself safe. I have been vaccinated. My partner has gotten vaccinated. So much less fear.
Can you tell them about the experience that we did? We went to the residence apartment.
Yes. So what we had to, we had tested residents, and we had a resident who had cancer, and her family wanted to see her. So we had her family come in. They had been COVID tested. We thought. Well, it turns out that one of the daughters had COVID, didn't know, gave it to her mother. So her mother, who was already suffering from terminal cancer, got COVID. So we kept her in her independent living apartment because, we're not going to move her to the hospital, possibly infecting more people because she already had a terminal illness. So for us, this meant that what we needed to do was provide care here. Well, this is the beginning of the pandemic when people were very afraid. So David and myself, who are experienced nurses, decided that we could do the care. So what we did is we got a registry organization to come in and be with the patient 24 hours a day, 7 days a week. And then David and I would go in and provide the care. And mainly what we wanted to do is model for the staff. Listen, we as the nursing directors are not afraid of this. We know that when we use proper PPE and we go into a resident's apartment and we care for them, that's what we signed up for as nurses. We agreed that this is something we wanted to do, and we did it safely. We did have 3 other independent residents get test positive for COVID. Out of the 4 there, 2 were already had terminal illnesses, and both of those residents succumbed to their terminal illness versus terminal illness versus COVID. We're not sure what really was the culprit there. The other 2 independent residents did very beautifully and recovered very nicely. So in their apartments, they were sequestered for the 14 days. And each day we would go to the door. We wouldn't actually go inside, but we'd go to the door. We had given them a pulse oximeter. So we had them check their pulse oximeter, we had them check their temperature, and we had them check their blood pressure with a BP machine. Then they showed us those results, we recorded those, and then we called them 3 other times during the day to make sure that they were okay. So through the 14 days of their quarantine, they came in contact with nurses 4 times throughout the day. And that was very successful. We did have some fear from other residents who were afraid they might get it, but it did not spread. We were able to contain it, and we did very, very well.
Are you glad that you're a nurse?
You know, I can't think of a better occupation for me. When I was young, my mother was a nursing assistant, and I became a nursing assistant, and I was 17 when I did that. And we worked together as CNAs. I worked for a couple of years, and then I went on to get my LVN with my mother, actually, which was not the smartest thing I did in my life. But after that, then we both went on and got our RN. And, you know, here's the way that I look at what I do of nursing. I think it's the highest calling on the planet is to be a nurse, because what you're saying is that you understand the reason you're here on this planet is to help other people. I truly believe the only reason we're here and the whole meaning of life, the nugget, the thing that keeps us going, is our relationships with other people. Mm-hmm. So I'm in a profession that pays me to get to talk to people, to get to know people, and to get to care for people. And boy, I think that's God's work. And, you know, I'm approaching what we call here in the United States as retirement age. I'm not ready to retire because I absolutely love what I'm doing. I cannot imagine a life without being a nurse.
And last, for the Japanese students, nursing students in Japan, I like to have some kind of, I guess, like more like an encouragement.
Yes. So here's what I can say. I would love for you all to come out and see the world. And by that, I mean come to the United States. Because here's the thing. Your Japanese culture is extremely gentle and kind and respectful. And we need that here in this country desperately. What I see from my young nurses, people who are born and raised in this country, is that they seem fairly entitled, and they seem not to be as compassionate and caring, as loving as I know the Japanese people to be. So what I would love is for you all to get your education there in Japan, but then come here to the United States and do nursing here in the United States. We need your calming influence here in the United States. And I would love to see you spread your culture, because we need that right now. And the way to spread your culture the most is for you to come here to the United States and work here. So I encourage you, if you don't want to come work, at least come and visit. Because when I visit other countries, it broadens my perspective of other people, and it lets me see, you know, we may look different, but that's the only thing that's different about us. Basically, humans are humans all across the globe. And unfortunately, in the 21st century, we are living in a time where we are very divided, where we have a hierarchy that puts people in the bottom rung of life. That's not okay. That's not acceptable. As a species, the only way we're going to survive is if we understand that cooperation is the key. We have one planet. We have one set of resources that all of us need to use. We need to learn to cooperate with each other. And I think the best way is for people to move from their homelands to other countries so that we can all see we're all the same. We're all in this together. We all love each other. And that's what we need to move forward.
Thank you so much.
Thank you.